Hi, good morning. This is Dr. Levine. I'm a chiropractic physician from Cheshire and Hamden, Connecticut. I have decided to temporarily shut down my office from the advice of my own primary care physician. In the interim, I'm requesting that my patients do some home stretching exercises until we meet again. Also, I've received information that a lot of the people that have died from this coronavirus had taken Advil, ibuprofen, and so I guess the recommendations are to take Tylenol, not Advil, ibuprofen, if you come down with any of the symptoms, which include fever, cough, runny nose, sore throat, or difficulty breathing. With that being said, let's go. We're going to do some basic stretching exercises. We're going to start with the neck. So we're going to start with just range of motion exercises with the neck. The neck and the back have the same motions. We can do forward flexion, extension, lateral flexion, and rotation. So starting with forward flexion, I want you to bring your chin down to your chest the best you can. And then bring it back up to neutral. Then we're going to go back into extension as far as you can. Bring it back to neutral. Laterally flex to the right. Bring it back to neutral. Laterally flex to the left as far as you can. Back to neutral. And then rotate to the right. Bring your head back to neutral. And then rotate to the left. So that brings your neck through all of its ranges of motion. Then the back can do the same motion. So we're going to bend down, try to touch your toes the best you can. Some of you, this is as far as you're going to get, that's fine. Don't force it, don't bounce. Just a slow, gentle, down as far as you can and hold it for a minute and then bring it back up. Keep your legs spread. And I want you to go back into extension. A lot of people will try to do that from the neck. We're not doing our neck right now, we're doing our back. So you're going to push your pelvis forward and go back into extension. Good. And then come on back. We're going to rotate to the left. Come back to neutral. Then rotate to the right. Come back to neutral. And then laterally flex to the right. Back up to neutral and laterally flex to the left. Good. Now to stretch the mid-back, a lot of people have pain between the shoulder blades. So we want to just clasp our hands together like this. Turn them inside out and pull away from your body as far as you can. You should feel a nice stretch between your shoulder blades. Great. Now for the back. For whoever has pets, they know if they have cats or dogs, the first thing they do when they get up in the morning is a big stretch. And sometimes you're in a rush and you're like, oh dear God, let's go. But the difference with the animals is they didn't lose the instinct. We jump out of bed and then we hurt ourselves. And the reason being is when you're sleeping, your discs fill with fluid. And so they're very plump and they're most susceptible to injury first thing in the morning. So people will come in to me and say, Doc, I don't know what happened. I was reaching down for my comb and I heard a pop. And they've what we call ruptured or herniated a disc. So I usually recommend first thing in the morning before you even get up, the best thing in the world to do is stretch that low back. So you're already in comfortable clothes, you're already in bed, it's easy to do, only will take a few minutes. So it looks like this. You're in bed or you're on a mat, you're going to just bring your knee into your chest and hold for the count of 5. So not 1, 2, 3, 4, 5, but 1 and 2 and 3 and 4 and 5. I tell my patients if your knees hurt for any reason, you can hold under like this and get the same effect. Also, I'm pretty flexible so I can bring my knees right into your chest. If this is as far as you can get, that's fine. Just do as much as you can and don't force it. So, and then you're going to bring the other knee into the chest, hold for the count of 5. So it's 1 and 2 and 3 and 4 and 5. Great.
Great. Now you bring both knees into the chest and hold for a count of 5. Again, 1 and 2 and 3 and 4 and 5. And again, you can hold your hands under your knees like this if your knees hurt for any reason and get the same effect. Okay, now I want my patients doing a core stability exercise, and this works the whole body, so it's a great exercise without putting too much strain on anything. It does require some balance, so I don't want anybody doing it on a bed. I'd rather have you do it on the floor just in case you lose your balance. So get a mat or some blankets or something to cushion the floor while you're doing it. So it's opposite. So you're going to put your right arm out and your left leg and hold it for the count of 5. So it's 1 and 2 and 3 and 4 and 5. Switch. Then you're going to do your left arm and your right leg. 1 and 2 and 3 and 4 and 5. This is a great exercise. It works your glutes, your hamstrings, your abs. Works just about every muscle in your body. And it's called core stability exercise. So I like my patients at least doing that once a day. Again, if you have any increased pain doing these exercises, just discontinue it till I see you. And hopefully that'll be in a couple of weeks when this coronavirus peaks. Okay, everybody take care, stay home, and be safe.